Good afternoon, everyone. My name is Maxim. I work at the Dynamica Clinic and I specialize in physical therapy. Today, I will show you 5 exercises for patients suffering from lower back pain, where to start, and how to progress these exercises so that you don't experience pain and discomfort in your lower back throughout the day. Let's take a look at them. The first exercise for the lower back is performed on all fours. You get down on all fours. Position yourself comfortably so you don't feel any discomfort, and then perform a movement arching your lower back up and down. As much as possible up, as much as possible down. It's acceptable to feel slight discomfort, about 2 points, and a mild tension in your lower back. After you do an excessive arch and an excessive rounding of your back, you find a neutral position, and from the neutral position you look at your left pocket, then at your right pocket. While performing this exercise, you may feel discomfort no more than 1 point. If you still have severe discomfort or pain, you are performing slow up and down movements. It's not necessary to do this with a full range of motion. You can go just a little up, a little down, a little up, a little down. You are learning to use your lower back without injuring it and without increasing the pain syndrome. After you have done the first exercise and learned to control your lower back and arching, you can move on to the knee plank exercise. It is performed as follows. You position yourself on straight elbows at a 90-degree angle and lie down. To prepare for this exercise, you lie on your stomach, place your elbows at a 90-degree angle to the bed, keep your legs shoulder width apart, relax your glutes, and pushing off with your elbows and knees, lift your lower back. By tilting your pelvis. You can do this exercise by tucking in your chin, looking at your navel, and you will feel your pelvis lift. And your task is to hold your pelvis for 15 to 30 seconds. And make sure that your lower back doesn't arch too much and isn't too flat. You should feel how your abdominal muscles are holding this position. The third exercise is also done from a lying position. You secure your body on the couch, place your hands parallel to your shoulders, your feet shoulder width apart, and position your elbows strictly in relation to your body. And without tensing your glutes, slowly, on a count of 3, you rise up without lifting your pelvis off the couch. This exercise is performed in 3 sets of 6 repetitions each. If, while performing this exercise, your pain moves down towards your foot, this exercise is not suitable for you. If the pain moves up from your foot towards your lower back, this exercise is suitable for you. We do this exercise in 3 sets of 6 repetitions every 3 hours. For this exercise, you will need a wall. Approach it, stabilize your pelvis, and for 30 seconds, lift your legs until you feel slight fatigue. You may be surprised, but at the moment of hip flexion, your lower back performs the necessary movement, and for 30 seconds, you lift your legs until you feel slight fatigue. If you experience pain, try lifting less and more slowly. You can also not only lift your legs, but lower them down as well. With your lower back and pelvis fixed, you can lower only your chest or only your head or your whole body. Don't strive for range of motion. Strive to avoid discomfort and pain while performing the exercise. The 5th exercise for the lower back is performed as follows. You place 2 objects on the floor. These can be pillows, cups, bowls, anything, and you lift these objects, but with a cognitive task. In this case, I'll take 100 minus 7 and count 100 minus 7, 93, and pick up the object. I count out loud and pick up the objects. 93 minus 7 is 86, then 79, and so on. You might make mistakes with the numbers. The main task is that you need to perform the movement and count the numbers. Your brain won't have time to feel pain or discomfort and will be focused on performing the movement of lifting the object and counting. This exercise is very effective for chronic pain. If you've had back pain for a year or two and no therapy has helped, try performing this exercise slowly and see if you feel any pain in your lower back. This exercise is performed as follows. That's -7, 93, 93, -7, 86, 80. 6 minus 7, 79, 79, -7, 72, 72, -7 is 65, 65, -7. When performing this exercise for your lower back, you shouldn't feel severe discomfort or pain, anything more than 3 points, and you should feel relief. When doing these exercises, you don't need to complete all 5 right away. On day 1, start with the first 2 exercises, then gradually add more and increase the load over time. And an important point, if you have a diagnosis of lower back pain and you are being treated by your doctor, for example, a neurologist with medication, you want to start doing gymnastic exercises, and you came across this video on YouTube, send this video to your neurologist so that he can watch it and see if these exercises won't harm you. And after that, you can start doing them. Good luck with the exercises, and your lower back will be grateful.